Hi, I hope you all are healthy and safe. Today I'll be addressing another aspect of coronavirus outbreak, emotional health or the psychosocial aspect of it. Uh, I will start with physical distancing versus social distancing, which was my yesterday's post. So when WHO came up with this term social distancing, I wasn't very happy about it. Social distancing, really, why social distancing? Because social distancing and isolation could lead to a range of mental health issues as people fear the prospect of living under the current restrictions of COVID-19 for months. So isolation coupled with uncertainties like how long will it last and what future holds for me, these are all valid questions but are significantly contributing to our anxiety. So now WHO has switched the term social distancing with physical distancing, which means that we need to maintain a physical distance of about 2 meters or 6 feet from each other to stop the spread of COVID 19 and at the same time emphasizing the importance of staying socially connected. So, coming back to social isolation, so social isolation can contribute to a wide range of mental health disorders. A couple of weeks back, I mentioned about depression, anxiety, sleeplessness, obsessive compulsive disorder, adjustment disorder. All these cases are resurfacing. So with social isolation, it can trigger heavier consumption of alcohol and drugs as well, leading to substance abuse disorder, leading to post-traumatic stress disorder. So we need to be preparing for the potential of a second wave in the fall. So taking care of our mental health is more important and more elusive than ever. So today we'll be talking about how to take care of our mental health and how to help our significant others to do so. So I'll start with staying connected. We human beings are social beings. We are social creatures, and it is very, very important for us to interact at physical level, interact at social level regularly. So being in touch with our significant others, through various electronic devices, this is where we can make good use of technology. We can stay connected with our significant others. We can emotionally connect with them, and at the time of crisis, we need to communicate with people we love more than ever. And at the times of stress, we work better in company and with support. So it is very, very important that we stay emotionally connected with people who matter to us. Now, having said that, there are a few things which I really, really want each one of you to take care of while, connecting socially with your significant others. One, please try not to sensationalize things and stop watching those TV channels who have these sensational stories and news. Second, if at all you have to share the content of coronavirus or the news or the happenings or something to do with coronavirus, make sure that it is coming from a trusted source. A couple of my patients actually slipped into relapse because a casual remark was being made by someone on the phone call and it turned the whole world upside down for them, and they slipped into relapse. The person who had called them had no idea about their mental health history. So it was very unintentional. The person had called to check on him, how they're doing, but it actually, creating and complicating things at my patient's end. So, maybe we are enjoying good mental health and we have better coping mechanisms, but you don't know how will that news or that rumor, coming from, untrusted source going to impact the other person. So we have to be very, very responsible here. The third thing is assess your social media activities very regularly because I have seen, and also some of my patients have reported that there are few WhatsApp groups or there are few accounts or there are few hashtags which are increasing or which are contributing to their anxiety and fear. So if you too feel that after talking to a person, after interacting with certain person or following certain group, you feel all the more anxious and you feel more of ghabarad, any restlessness, and sleeplessness happening to you, then you need to mute or you need to unfollow, that group or that account or that person for the time being. This is in your interest. So these are the three things which I'll repeat for you. That one is, don't sensationalize things. Second, share news only from trusted sources. And third, regularly assess your social media activities and make sure that they are not adding to your anxiety levels in any way. Next, what I'll suggest you to do is try and anticipate distress. It is okay not to feel okay all the time, and it is all right for you to feel vulnerable and overwhelmed, especially, those people who have had mental health history or those who've been struggling with long physical health condition. It is all right for you to be feeling, vulnerable and overwhelmed. Please remember that these are usual reactions to an unusual situation that we all are facing. What is important is, or one beautiful way of coping with it is talking. I'm a big fan of talking therapy. I feel it's the best natural remedy. So, talk about all these anxiety provoking, depressing, disturbing, unhealthy thoughts with someone. That someone can be, your parent, your friends, your significant others. What is very, very important is that you ventilate. Don't sit with them alone. Don't keep them trapped inside your system. See, I do understand that sometimes it can be terrifying to be talking about your insecurities and fears and uncertainties with someone, especially your parents, because you feel that they will be disappointed in me. But still, I would strongly recommend that you think of a person, you sit down, you think of a person with whom you can pour your heart out and talk about all these unhealthy thoughts and feelings, because sitting alone with them is not going to help. It is only going to make the situation worse for you. So it is very essential that you acknowledge what is going inside your mind, all those unhealthy, unhelpful thoughts, and you ventilate them. It is very, very important that you take care of your mental health, and extremely important that you take mental care of mental health of others as well, people, in your proximity. So I hope that all these tips will help you in improving your mental health. And if you have any questions, or if you have any concerns, or if you want to book an appointment with us for free consultations, feel free to DM us. We'll be happy to help you out. Till next time, take good care of yourself and sleep well.